It's important to get kids eating well from the start because that's their foundation for life.
You know, we know, especially when kids are first starting to develop and grow, especially in the first few years, it's extremely important what they're putting in their bodies and determinant of how well they're going to grow and how well their brain's going to develop.
Good eating habits actually do begin in the womb. Things that happen during that time that can set you up later in life for things like the development of insulin resistance or obesity or heart disease.
Critical windows of susceptibility are times in development when that developing human is most likely to be affected by chemicals in the environment. Industrial use of pesticides has increased since after World War II. If you look at certain diseases, those have increased as well since that time. So our concern is that pesticides may be one piece of the pie that's causing the increased risk of diseases such as childhood cancer, reproductive disorders, obesity, metabolic disease, heart disease, cancers.
There are a lot of chemicals that end up in food because they're allowed in food processing or food packaging. They're not actual necessary components of the food.
When you introduce these chemicals into the system, it sort of counteracts the healthy aspects of food.
There are chemicals that actually promote obesity. They're called obesogens. So BPA is actually one of them. It's been shown to change the way the fat cells develop and where they're laid down in the body.
We have an industrialized food system, and we're about volume over quality. Many moms and dads shop with their kids, and the kids are affected by advertising that they see on TV or by what their friends eat at school, and they want those foods.
You know, I remember when I grew up, it was definitely like Twinkies and chips and a Capri Sun in my lunchbox every day, and that to me was food, and I was excited that that was in my lunch.
They want those foods because they taste great. They're yummy. Everybody has an inkling for junk food. I even have an inkling for junk food.
Now, thinking back about that and, you know, talking with my mom, how could you put that in my lunch? Realize that's really not food. But for a lot of our families, that is food.
Unfortunately, in some communities, when they walk into their market, the first thing they see is not fruits and vegetables.
For me, food is quality food that has nutritional value that contributes to a kid being able to grow and develop to the best of their potential.
There's a lot that parents can do, and there have been some good studies that show that by putting kids on an organic diet, they can markedly decrease their levels of pesticide in a very fast amount of time.
We tell our patients all the time to eat a low-fat diet because of the cardiovascular benefits, but in addition to the cardiovascular benefits, there's the added benefit of reducing exposure to the persistent organic chemicals that accumulate in fat, so things like PCBs and dioxins.
By changing policy, food policy, then hopefully we can impact the incidence of those diseases.
I would say not just clinicians, but any healthcare provider who has a face-to-face interaction with a patient and has an opportunity to talk about nutrition, it's an opportunity to do education. And of course, when you're speaking with women who are either pre-conception or in pregnancy or have just had a baby, it's really a time when they're very receptive to these kinds of messages.
Doctors are powerful. Doctors are trusted and believable. And doctors with a passion can then persuade policy.